Welcome back to the deep dive, everyone. Today we're diving into a topic that's probably all too familiar for many dog owners out there: canine infectious respiratory disease complex, or, as most of us know it, kennel cough.
Yeah, kennel cough, the name kind of makes you think of a bunch of dogs in a, well, kennel, all hacking away, right?
Yeah.
But there's a lot more to CIDC than that simple name might suggest.
Right, it's definitely more than just a kennel problem. And for this deep dive, we've got a whole stack of research articles on CIRDC and cough in dogs to unpack.
Absolutely, some really interesting stuff. And today, we want to take you beyond just that kennel cough label and really dig into the nitty-gritty.
Yeah, let's figure out what's actually going on. So, first things first, what exactly are we dealing with here? Is it one single disease or something more complex?
Well, that's where things get interesting. CIDC isn't caused by just one single villain. It's actually a whole team of culprits, a mix of different viruses and bacteria that can gang up on a dog's respiratory system.
So it's not just one bad bug, but a whole party of them.
Precisely. Think of it like a potluck of pathogens,
Mm.
each contributing to the overall problem.
A potluck of pathogens. I like that. All right, so who are the usual suspects? If we're talking about the main players in this canine respiratory whodunit, who comes to mind?
Well, traditionally when we think CIRDC, a few key players always come to mind, like the classic gang, the ones we've known about for a while.
BOG kennel cough crew.
Exactly. So we've got Bordetella bronchoseptica, often shortened to just live canine adenovirus type 2, or KAV2 for short, canine distemper virus, the infamous CDV, canine herpes virus, CHV, and canine parainfluenza virus, that's CPIV.
Ah, some familiar names there. I bet a lot of owners will recognize those from their dog's vaccine records, but from what I've read, it seems there are some newer kids on the block, right?
You got it. Recent research has really shed light on a bunch of other pathogens that also seem to be involved in CRIDC.
So the guest list for this pathogen party keeps getting longer?
It does. So we've got canine influenza virus, or CIV, canine respiratory coronavirus, that's CRCoV, canine pneumovirus, CNPNV, Mycoplasma cynos, which is a type of bacteria, and another bacterium, Streptococcus aqueous subspecies zooepidemicus. That one's a mouthful.
Yeah, I'm going to stick with SU epidemicus for that one. It really is a whole cast of characters. And actually, I saw canine bocavirus and canine hepicivirus mentioned in one of the articles. Do those fit into this whole CRDC picture?
Well, they've definitely been found in dogs with respiratory issues, and there's been some links suggested. But for now, they're not considered major drivers of CRDC, so we won't be diving into them in depth today.
Fair enough. We got to focus on the main culprits. So let's zoom in on one of those Bordetella bronchoseptica. You mentioned it earlier. This one can actually cause CRRDC all on its own, right?
It can, yeah. Bordetella bronchoseptica, or blub, is quite capable of causing the whole shebang solo. When a dog gets infected with blub, it typically takes between 2 to 10 days for symptoms to show up. That's the incubation period.
So about a week or so before you start hearing that cough.
Right. And the classic signs, a dry, hacking cough, often described as paroxysmal.
Meaning?
It comes in these sudden, intense bouts. You might see some nasal discharge, too. In severe cases, although it's thankfully not that common, dogs can get really lethargic, develop pneumonia, and in rare instances, it can even be fatal.
So usually not deadly, but definitely something you don't want your dog to get. What's going on inside the dog when this blob takes hold?
Well, one thing that's interesting about blob is that it mostly stays on the surface of the respiratory tract. Specifically, it targets the ciliated mucosa.
Okay, hold up. Reminder for our listeners, what's that exactly?
So the ciliated mucosa is basically the lining of the airways, and it's covered in these tiny hair-like structures called cilia. Think of them as little brushes constantly sweeping debris out of the lungs.
They're keeping things clean.
Exactly. But when blob gets in there, it causes inflammation, and you get an influx of polymorphonuclear cells, a type of white blood cell, rushing to the site of infection, like the body's first responders trying to fight off the invaders.
Okay, but how does that lead to the cough?
Well, blab has this sneaky way of lashing onto those cilia, and then it releases toxins that essentially paralyze the cilia, a process called ciliostasis.
So the cleaning crew is out of commission.
Exactly. And that disruption of the normal cleaning process, the mucociliary clearance, is what causes that buildup of mucus and triggers that nasty cough.
So that's why they're hacking away. Makes sense. How long does this usually last? And is it something dogs can easily catch again?
It varies, really. Mild cases might clear up in a few days, but more severe ones can drag on for weeks, sometimes even longer. And here's the kicker. Even after the cough is gone, dogs can still shed those blab bacteria for months.
Oh, wow. So they could be spreading it without even seeming sick.
Exactly. It's a sneaky one. And when it comes to immunity, the dog's body does fight back by producing IgA and IgD antibodies, particularly in the mucosal lining of the airways.
So their immune system is learning to recognize and fight off blab.
You got it. It's building up defenses to help prevent future infections.
Okay, good to know. Now let's switch gears to another player you mentioned, canine herpes virus, or CHV. I know herpes viruses can be tricky customers. What's this one all about?
Right, canine herpes virus is an enveloped DNA virus, and it specifically targets canids, so dogs and their wild relatives. It can be devastating in pregnant dogs who've never encountered the virus before,
Yeah.
and for newborn puppies, often causing fetal or perinatal death. But the interesting thing is, when puppies are older than 2 weeks, or adult dogs have had their first exposure to CHV, you rarely see any clinical signs at all.
Wait, so most adult dogs who get infected don't show symptoms? That's surprising. How's that possible?
Well, what happens is the virus enters through the respiratory and genital tracts, but then it travels to the sensory ganglia. These are clusters of nerve cells, and it kind of goes into hiding.
Like it's lying dormant.
Exactly. It establishes a latent infection, meaning it's just hanging out on those nerve cells, not actively causing trouble. It can stay there for a long time, possibly even the dog's entire life, and might only reactivate if something weakens the dog's immune system.
Like what?
Stress is a big one. Also other illnesses, immunosuppressive drugs, even pregnancy or old age. And when it does reactivate, the virus can start shedding from those mucosal surfaces again.
So when it pops back up, does it always cause problems?
Not always. Often, when it reactivates, it's asymptomatic, no obvious signs the dog's even shedding the virus. But in some cases, reactivation can lead to those CIRDC symptoms we talked about, as well as other issues.
What kind of other issues?
Well, things like eye problems, reproductive issues, genital lesions, even more systemic illnesses. So while it might not be the main culprit in most adult cases of kennel cough, CHV can certainly complicate things under the right circumstances.
Okay, so a bit of a wild card, this CHV. Now, what about canine parainfluenza virus, or CPIV? I feel like I hear that one mentioned a lot with kennel cough.
You're right, CPIV comes up a lot. It's super common in dogs diagnosed with CRDC, and it's highly contagious, especially in places with lots of dogs in close contact. Shelters, kennels, dog parks.
So kind of a recipe for spreading it.
Pretty much. And here's the thing about CPIV. It's often involved in what we call co-infections.
Meaning?
The dog gets infected with CPIV at the same time as some other virus or bacteria. And these co-infections can make the illness much worse.
So CPIB is like the bad influence, making things even worse for the dog.
You could say that. And a lot of studies have shown that CPIV plays a really significant role in causing kennel cough in the first place.
So it's often part of the problem, even if it's not acting alone. Now, we've talked about these specific pathogens, but the paper also mentioned host and environmental factors playing a role in CIRDC. What does that mean in terms of a dog actually getting sick?
Oh, that's huge. It's not just about what the dog is exposed to, but also their individual susceptibility. Things like their age, their overall health, their immune system strength, all of that comes into play.
So a healthy adult dog might be less likely to get sick than a puppy or a senior dog.
Exactly. And stress plays a role too. Being in a crowded shelter, for example, that can weaken a dog's defenses and make them more vulnerable.
Makes sense. It's like a combination of exposure and susceptibility, right?
Now, let's talk about the name itself, kennel cough. The article mentioned it's also historically known as canine infectious tracheobronchitis. So what does that actually mean in terms of what's happening in the dog's body?
Right. Whether you call it kennel cough or canine infectious tracheobronchitis, what we're talking about is inflammation of the trachea and bronchi, the airways.
Okay, and that leads to the cough.
Exactly. And the classic kennel cough is a sudden onset of this really harsh, dry cough. It often sounds like a honking goose.
Oh yeah, that's a sound most dog owners are familiar with.
Huh.
Not a pleasant one. And what else might you see?
Well, the cough itself is usually the most prominent sign, but you might also see some discharge from their nose and eyes. And the coughing fits can be pretty intense.
Poor pups. How long does this usually last?
Most of the time, the symptoms hang around for a few days to a couple of weeks, and they tend to be relatively mild. But like we mentioned before, puppies and dogs with weakened immune systems, they can have more serious complications.
Like what? Well, the infection can spread down into the lungs and cause bronchopneumonia. And that can lead to more severe symptoms.
Yeah.
Difficulty breathing, weight loss, fever. In some unfortunate cases, it can even be fatal.
So while it's often mild, it can be serious, especially for vulnerable dogs. Now, one of the articles gave some specific stats about Bordetella bronchoseptica in the UK. What did it say?
Yeah, so this survey was done between 2016 and 2019, and it found that blob was present in about 14.5% of respiratory samples they took from dogs.
So not exactly rare.
Nope, pretty common. Interestingly, the highest proportion of positive samples was during the winter, about 17.3%. Then it was summer, then autumn, and then spring was the lowest.
So a bit more common in the colder months, but really present year-round.
It seems that way. Another interesting thing from the survey was that there weren't any clear geographic trends. Blob was pretty much evenly spread across the UK.
So no matter where you are, it's something to be aware of. Okay, we've talked about the pathogens themselves, but let's shift gears and talk about the dog's own immune system. How does their body fight back against these invaders? The first paper talked about the lymphoid tissues in dogs and their role in immunity.
Right, these lymphoid tissues are basically like little immune outposts throughout the body. And in the upper respiratory and digestive tracts, dogs have three main types: the pharyngeal tonsil, the lingual tonsil, and the palatine tonsils.
And these are important for fighting off infection.
They're crucial. They're like the first line of defense in those areas.
Hmm.
And when we give dogs vaccines orally or intranasally, these tonsils are right there, ready to encounter those weakened pathogens and kickstart the immune response.
So they're kind of like training grounds for the immune system.
You could say that.
Yeah.
And while these tonsils are physically separate, they're all part of the same interconnected immune system. That's why even vaccines given by injection can help protect against respiratory diseases.
It all works together. Speaking of vaccines, the first article goes into a lot of detail about how well they work against those CRDC pathogens. What are the key takeaways for us dog owners?
Well, the good news is that vaccines against CDV, CAV2, and CPIV can be very effective in protecting dogs from CRDC. These vaccines can significantly reduce the risk of infection and make the symptoms much milder if the dog does get sick.
So those are the big three to vaccinate against, but what about CPIV on its own? I think I remember reading something about that.
Yeah, so some studies have shown that vaccinating against CPIV alone might not be as effective. That could be because of the small sample sizes in those studies, though. It seems like combination vaccines that target multiple pathogens at once might provide more robust protection.
So maybe those combo vaccines are the way to go.
Could be. And to understand why vaccination is so important, the article brought up some interesting examples from other animal species.
Oh, like
Well, things like bovine respiratory disease in cattle and equine herpes virus and influenza in horses. Even if the vaccines don't prevent every single case, they can make a huge difference at the population level, especially when you have a lot of animals living in close quarters.
so herd immunity not just for humans.
Exactly. And it's not just about preventing infection altogether. Vaccines can also reduce the amount of virus or bacteria that an infected dog sheds, which helps to break the chain of transmission.
Less shedding means less spreading. So even if my dog gets vaccinated and still gets sick, it could help protect other dogs.
Right. And there's another really interesting point about some of the CIRDC vaccines, specifically the ones against CAV2, CPIV, and BLIB. Dogs who get these vaccines can actually shed those weakened vaccine strains for a while afterward.
Wait, so they could be spreading the vaccine virus?
Not the actual virus, no. These vaccine strains are weakened, so they can't cause the full-blown disease. But they can still stimulate the immune system of other dogs they come into contact with, giving them a bit of indirect protection.
That's pretty cool. So what are the main benefits of vaccinating my own dog against CIRC?
Well, like we said, it reduces their chances of getting sick in the first place.
Hmm.
And if they do get infected, the symptoms will likely be much milder and shorter-lived. This also means they might not need antibiotics, which is important in the fight against antibiotic resistance.
Right. Antibiotic resistance is a huge concern. So even if vaccines aren't 100% perfect, they're still really valuable tools.
Absolutely. And for dogs who are frequently around other dogs, going to kennels, dog parks, shows vaccination is strongly recommended by the World Small Animal Veterinary Association.
Okay, so vaccinations are a must for those social butterflies. Now, we've covered CIRDC itself. Let's talk about one of the most obvious signs, that cough. The second paper you gave me really goes in-depth on coughing and how this reflex works, which is fascinating stuff. And the first thing it points out is that cough is considered the most important respiratory sign. Why is that?
Well, coughing is often the first and most noticeable sign that something's off in the respiratory system. It's a natural defense mechanism designed to clear the airways of irritants.
So it's actually a good thing, in a way.
It is to a point. It helps protect the lungs by expelling mucus, foreign objects, anything that shouldn't be down there. But like with anything, too much of a good thing can be bad.
How so?
Well, all that forceful coughing can actually cause more inflammation in the airways. And over time, that chronic coughing can lead to permanent damage in the delicate tissues of the lungs and bronchi.
Yikes, so the cough itself can actually make things worse.
It can, unfortunately. The article even mentioned that in humans, chronic cough is a really big problem, affects something like 11 to 18% of people.
Wow, that's a lot of coughing. Okay, let's get technical for a minute. How does this cough reflex actually work? What triggers it?
So the cough reflex is usually triggered by irritation in the larynx, trachea, or bronchi. The only time it's not is when you have a voluntary cough.
Right, like when you clear your throat on purpose?
Exactly. But most of the time, it's triggered by something irritating those airways.
Mm-hmm.
And once those receptors are activated, it sets off this chain reaction controlled by the medulla in the brainstem.
So the brain gets the signal that something's wrong and tells the body to cough.
Right. And the whole process happens super fast. First, you get a quick intake of breath, then the epiglottis closes and the vocal cords shut tight, trapping the air in the lungs. Then the abdominal muscles contract, pushing the diaphragm up, and finally the glottis opens suddenly, and boom, you've got that forceful expulsion of air.
That's a lot happening in a split second. The article also mentioned something about expulsive and recuperative phases of cough. Can you explain that?
Sure. So the main sound we hear when someone coughs is during the expulsive phase when the air is forced out. But there can sometimes be a second sound, caused by the glottis closing again after the air is expelled.
So like a double cough sound.
Exactly. And that second sound is more common in people or animals with airway diseases. But it might not always be there, even in healthy individuals.
Interesting. So the sound of the cough can give you some clues about what might be going on. Now, let's talk about the receptors involved in this reflex. The article mentioned that the larynx and tracheobronchial tree are the most sensitive areas for triggering cough in dogs. Why is that?
Well, it's all about where those sensory receptors are concentrated. And those areas, the larynx, trachea, and bronchi, are loaded with receptors that are sensitive to a whole range of stimuli.
So they're constantly monitoring for anything that shouldn't be there.
Exactly. And they can pick up on mechanical irritation, like something physically touching the airway lining, chemical irritation, like fumes or smoke, and even changes in temperature. They're like little alarm systems, constantly scanning for trouble.
So let's talk about those receptors specifically. What about the ones in the larynx and pharynx?
Well, the laryngeal receptors are mainly triggered by mechanical and chemical stimuli, and their signals travel up to the brain through the recurrent laryngeal nerve, which is part of the vagus nerve. Interestingly, studies have shown that the larynx isn't as sensitive as the trachea and bronchi when it comes to triggering a cough.
So the lower airways are more ticklish, so to speak.
You could say that. Now, the pharynx is a bit different. It's mainly innervated by the glossopharyngeal nerve, but there's a small branch of the superior laryngeal nerve, also part of the vagus, that might be involved in cough reflexes coming from the pharynx. And another thing that can trigger coughing from the pharynx is postnasal drip.
Postnasal drip, like when you have a cold and mucus drips down the back of your throat.
Exactly. And that can happen in dogs too, especially with sinusitis or nasopharyngitis. So you can get a cough from either direct irritation of the pharynx or from those inflammatory mediators spreading from the nasal passages.
So either way, it's annoying. What about the receptors in the trachea and bronchi? The article mentioned two types, RRs and C fibers.
Right. So RRs are those rapidly adapting receptors we mentioned before. They're found in the lining of the trachea and larger bronchi, especially at those branching points. And they're super sensitive to mechanical stimuli and also respond to various chemical irritants. They also play a role in immune and inflammatory responses, reacting to things like histamine, bradykinin, prostaglandins, and substance P.
So they're like the front line of defense in the lower airways.
You got it. And studies have shown that dogs have a much stronger cough reflex when those tracheobronchial receptors are stimulated compared to stimulation of the pharyngeal receptors. So those RARs are likely the main players in that classic kennel cough sound.
Okay, and what about the C fibers? I remember reading that they don't actually cause a cough directly.
Right. C fibers are these non-myelinated nerve fibers that are found in the walls of the pharynx, bronchi, and even the alveoli, those tiny air sacs in the lungs. They respond to similar stimuli as the RRs, but they don't typically trigger a cough. They're actually more involved in regulating breathing itself.
So how do they do that?
Well, when C fibers are stimulated, they can cause apnea, that's a temporary pause in breathing, and they can also trigger rapid, shallow breathing. They can even inhibit the cough reflex in some cases. But when they're activated, they also release certain neurotransmitters that can cause inflammation in the airways.
So they have more of an indirect role in coughing, but still contribute to the overall problem. The article also mentioned lung stretch receptors. What are those all about?
So those are the slowly adapting receptors, and they're located in the walls of the lungs. They respond to stretching of the lung tissue, and research has shown that blocking these receptors can actually reduce the cough response, especially those big, forceful expiratory efforts.
Interesting. So they're not the main trigger for coughing, but they do play a role. So it seems like there's this whole network of receptors working together to control the cough reflex. The article then talked about something called plasticity of cough receptors. What does that mean?
So plasticity basically means that these receptors can change their sensitivity and even their function over time, depending on what's happening in the airways. For example, if there's inflammation present, those RAR fibers can become much more sensitive to mechanical stimuli.
So, like, they're on high alert, ready to trigger a cough at the slightest touch.
Exactly. And that's why you might get a really intense coughing fit from something that wouldn't normally bother you if your airways are already inflamed.
And it's not just the RARs, those C fibers can become sensitized too, leading to even more inflammation.
So it's like a vicious cycle. The inflammation makes the receptors more sensitive, which leads to more coughing, which causes more inflammation.
Exactly. It's one of the reasons chronic cough can be so hard to treat. Now, the article also delves into some of the specific molecules involved in activating these receptors, like those vanilloid receptors or VR1 receptors. They're found on those C fibers and are triggered by things like heat, acid, and even capsaicin, the stuff that makes chili peppers spicy. So that burning sensation you get from eating a hot pepper is actually activating those cough receptors.
It is. And scientists are constantly learning more about these receptors and how they work, which could lead to new and better treatments for cough in the future.
That's exciting. The paper also touched on the complexity of cough regulation and how the brain plays a role.
Right. It's not just those receptors in the airways that are involved. The central nervous system, the brain, and spinal cord also plays a big part in how we perceive and respond to cough stimuli.
So it's not just a simple reflex?
Nope, it's much more complex than that. The brain can actually become sensitized to those signals from the respiratory tract. And in some cases, that can even lead to non-respiratory stimuli triggering a cough. Like, for example, gastroesophageal reflux when stomach acid backs up into the esophagus. That can sometimes trigger a cough even though it's not directly irritating the airways.
Wow, that's fascinating. So our brains can actually learn to associate certain things with coughing, even if they're not directly related to the respiratory system.
Exactly. It's a really complex interplay between the peripheral nervous system, those receptors in the airways, and the central nervous system.
Okay, so we've covered how the cough reflex is triggered. What about the actual mechanics of coughing? What muscles are involved in that big, forceful expulsion of air?
Well, a lot of people think that closing the glottis, that's the opening between the vocal cords, is absolutely essential for an effective cough.
Right, to build up pressure in the lungs.
Exactly. But research has shown that even if the glottis doesn't completely close, you can still have a pretty effective cough. It might not be as strong, but it can still clear out the airways.
Interesting. So the glottis doesn't have to slam shut for the cough to work.
Right. And another interesting thing is that the reflex for closing the glottis actually has different neural pathways than the rest of the cough reflex. It's like its own separate reflex that's integrated into the overall cough response.
So the body's got multiple ways to make sure that cough happens, even if one part of the system isn't working perfectly. The article also mentioned that coughing can be especially bad for dogs with allergies or asthma. Why is that?
Well, dogs with allergies or asthma already have sensitive airways, and all that forceful coughing can really irritate those airways, making the inflammation worse.
So it's kind of a double whammy. They're already prone to airway inflammation, and then the coughing makes it even worse.
Exactly. And in those cases, suppressing the cough can actually be really helpful because it gives the airways a chance to heal.
So sometimes stopping the cough is actually the best thing for the dog.
It can be, yeah. Especially if it's a dry, unproductive cough that's not actually clearing anything out of the lungs. Now, another thing the article talked about was mucus production and how it's linked to the cough reflex.
Right, because coughing up phlegm is a common symptom, right?
It is. And it turns out that stimulating those cough receptors also triggers the production of mucus in the airways, and that mucus serves a really important purpose. It traps irritants and helps to clear them out of the lungs.
So it's like flypaper for those little particles.
Pretty much. It catches all the bad stuff, and then the cilia, those little hair-like structures we talked about earlier, sweep the mucus up and out of the airways, or the cough expels it.
So it's another layer of protection for the lungs. What about the different sounds a cough can make? Does the way a dog coughs tell you anything about what's going on?
It can, yeah. The article describes a cough as a series of short expiratory efforts, each with a compressive phase and an expulsive phase. And the specific pattern of those efforts, how many there are, how forceful they are, the sound they make, can give clues about where the cough is coming from and what might be causing it.
So a cough from the trachea might sound different from a cough from the bronchi.
Exactly. And the presence or absence of that second cough, sound, that glottal closure, can also tell you something. And then there's the quality of the cough. Is it dry and hacking? Or is it wet and productive, meaning it's bringing up phlegm? All those things can be helpful in figuring out what's going on.
It's like a language of coughs. Now, the article also mentioned something called dynamic airway compression. What's that about?
So dynamic airway compression is basically what happens when the pressure inside the airways drops below the pressure outside the airways during a cough. And this can actually make it harder for the cough to effectively clear out mucus and other stuff.
So it's like the airways are collapsing inward, making it tougher to get the air out.
Right. And the amount of compression depends on a couple of things: the peak airflow that the dog can generate and the diameter of their airways. So if the airways are already narrowed, like in asthma, or if the dog is weak and can't cough forcefully, dynamic airway compression can become a real problem.
Makes sense. So it's all about airflow and airway diameter. The paper also talked about upper airway cough syndrome, which is sometimes called postnasal drip. Is that a common cause of cough in dogs?
You know, that's actually a bit of a controversial topic in veterinary medicine. In humans, upper airway cough syndrome caused by postnasal drip is a well-recognized problem. But in dogs, it's not as clear-cut.
How come?
Well, for one thing, there's no universally agreed upon definition of what postnasal drip actually is in dogs, and it's hard to measure objectively. So while some vets believe it's the common cause of cough in dogs, others are more skeptical.
So more research is needed on that one. Now, the paper also talked about different breeds and age groups being predisposed to certain cough-causing conditions. What are some of the things to watch out for?
Right, so certain breeds are more prone to certain problems. For example, small, middle-aged dogs are more likely to develop things like chronic obstructive pulmonary disease, tracheal collapse, and chronic mitral valve disease, all of which can cause coughing. And then larger and giant breeds, as they get older, are more susceptible to congestive cardiomyopathy, laryngeal paralysis, and pneumonia. Brachycephalic breeds those with the smushed faces, like bulldogs and pugs are predisposed to tumors and airway obstructions. And older female dogs are more likely to have metastatic mammary cancers, which can sometimes spread to the lungs and cause coughing.
So knowing your dog's breed and age can give you some clues about what might be going on if they start coughing. The paper also mentioned a connection between ACE inhibitors and coughing in humans, but said there's not much information about that in dogs.
Yeah. ACE inhibitors are a type of blood pressure medication, and cough is a known side effect in people. So if a human patient starts coughing after starting an ACE inhibitor, doctors will often consider that as a possible cause. But the research on that connection in dogs is pretty limited.
So it's something to keep in mind, but we need more research on that one. Okay, so beyond coughing, what are some other signs that a dog might have a respiratory problem?
Well, there are a few things to look out for. Sneezing is a common one, and nasal discharge that can be clear, white, yellow, or even green, depending on what's causing it.
Yeah.
And then there's difficulty breathing that can range from mild to severe. You might notice your dog breathing faster than normal, or they might be using their abdominal muscles to breathe, which is a sign they're really struggling. And exercise intolerance is another one. If your dog suddenly can't keep up on walks or gets tired easily, that could be a sign of respiratory problem. And in severe cases, you might see cyanosis, which is a bluish discoloration of the gums, tongue, or lips. That's a sign that they're not getting enough oxygen.
So basically, any changes in their breathing, their energy level, or the color of their gums are definitely worth getting checked out by a vet. The article also briefly mentioned passive smoking.
Yeah, it's not as definitively proven in dogs as it is in humans, but there's definitely a possibility that exposure to secondhand smoke can contribute to respiratory problems in dogs, so it's always best to avoid smoking around your pets.
Absolutely. And the article also pointed out